Okay, good morning, everybody. First of all, let me say thank you all for being here. It's absolutely great to see so many people together at a meeting like this, which is so important, as we will obviously find out, and as you obviously all know. And many of you here have been involved in this issue for quite a while. So it is a pleasure for me to welcome you, and also to say a special thanks to all of the presenters and the speakers that you will hear from during the course of the morning. And as you all agree, and this is the reason you're here, this is an unbelievably important topic, a very important one, and one that requires our leadership. Requires our involvement, requires our commitment, and as will be very clear during the course of the day, we have a responsibility here, so that as healthcare leaders, there's a special obligation upon us to broaden the debate, broaden the discussion, articulate a different view of this issue than sometimes you hear in the public media. And you all know what the issue is. You all know the statistics. I don't need to go into them here because you will hear quite a bit about them in the presentations coming up. But as you all know also, this is way beyond statistics. This is about human suffering. This is about families. This is about kids. This is about the abdication of leadership by many in the political environment. This is a moral issue. It's a cultural issue. This issue says something, and our response or lack thereof says something about us as a culture. It says something about us as a community. And it begs the question, how do we help change that? So, it's a public health issue. And this is what's important here for us to recognize, that this is a public health issue. We get exercised about many other issues, all important, not to diminish any of them, but we get exercised about, things that happen to kids with getting hurt with toys. We get very exercised about issues of vaping, most recently. Yet when you compare the damage done by some of those relative to the damage, in its broader sense, done by gun violence, many of those other things that we get so exercised about are relatively minuscule compared with what we are suffering from with regard to this issue. So that's why it's so important to have a meeting like this. And I know many of you in the room have been involved in this for a while, as I mentioned earlier. And you have to be complimented for being involved in this issue. But if we get involved as a collective, as a large group working together, I think we can have more traction. So today is an opportunity for us to sit back during the next couple of hours and just think. Many of you are going to hear some of the stuff you already know, but think about it a little bit differently when you hear it. Sometimes we get, kind of become immune to some of these statistics that we hear. But just look at it a different way. As somebody once said, if you look at things differently, the things you look at change. So, we do have a responsibility as healthcare leaders. We are major influencers in our communities. We have a voice. In most cases, we're listened to. in most communities, we're the biggest employers. Northwell, for example, is the biggest private employer in New York State with 72,000 employees. That's an influence potential. What do we do with that? So we have an obligation to educate, to influence, to advocate, to expand programs, to demystify, to prevent myth, such as, for example, which we have to be very careful of, that all we are suffering from here is just a severe mental health crisis. Yes, we do need mental health services, and yes, we all need to do it better than we're doing it today. But let's not fall into the trap, as some people have suggested at the highest levels of our leadership, that what we need to do to resolve this issue is open up psych institutions again. That comes from ignorance. That's not an educated mind. That's an ignorant one. We have a responsibility to reframe the discussion as a public health issue, because I think if you do, and this was the reason that we started to get involved in this, is if you reframe the discussion, I think you can get more traction. And we can obviously find solutions without necessarily curtailing those rights guaranteed by the Second Amendment. This is not just a Second Amendment issue. That's a different kind of a debate, one that you can have. But the results of what we're dealing with today is something that we have to take a major, major responsibility for. This is our community. Whether you're looking at it from a local perspective or looking at it broadly, this is our community. We are leaders in that community. Therefore, we have to demonstrate that leadership. So as a result of today, my hope would be that we find ways to go back to our own places of endeavor and our own organizations and ask a question, and what do we do in our organizations? We'll talk a little bit about this. What do we do in our local communities? What do we do collectively, regionally? What can we do collectively, nationally? I would hope, and I would certainly believe that this will happen, that many of us in this room will be working together in the future like we've never worked before. Many of us are meeting for the first time, even though we've all been dealing with parts of it in different areas. Now you bring it together a little bit, therefore you have a bigger leverage. This is about what kind of a society we want. This is what our political leaders should be talking about. But since they're not doing it the way they should, at least many of them, we can fill that vacuum. So with that, I say again, welcome. At the back of the program, you will see that there's a call to action. I would love to see, like I put an ad in the Times some time back, I would love to see a future ad, for example, in the Times and in every newspaper across the country that would have all our names listed saying, we as a collective are involved in doing the following, X, Y, Z. That we can do. So having all of you here that believe in this issue, that believe in the need to do something about it, it's heartwarming, and it's just great to see like-minded people who are interested in making our society a better place. So again, thank you, and with that, let me turn it over to Dave Battinelli, and we'll begin the program. Thanks very, very, very much.